Banerjee, epidemiologist, biostatistician, faculty member. And in this segment, I'm going to be going over a poster that was submitted and presented at the Scientific Study of Sexuality in Philadelphia, PA. So for starters, as you can see, we were looking at sexual minority status and suicidal ideation and overall mortality. So we were looking for if sexual minority status is connected to suicidal ideation and overall mortality here, and in males versus females. So even though we know that those who self-identify as sexual minority attempts suicide at higher rates, we don't necessarily know how it is within sexual minority population among males and females. Basically, is there a difference between gays and lesbians in terms of suicidal ideation, and in terms of suicidal ideation. So as you can see, here's some social determinants and vulnerabilities of social determinants of health. There's a lack of data, there's poverty, risky behaviors, a lot of the intersectionality that takes place, discrimination, lack of access to healthcare. 8% of LGBTQ and 27% of transgender individuals report being denied necessary healthcare treatment. And there's a lot of LGBTQ that have 6-fold higher rates of depression compared to the overall population, and over twice as likely to experience suicidal thoughts, and 4 times more likely to attempt suicide. So there's proximal stressors and distal stressors. These are some factors that Dr. Anderson likes to look at. And so this was a visual that we created here that we got from another paper. So in terms of what was looked at, this was looking at all-cause mortality and suicidal ideation. And so did people that were gay and lesbians, did they have more likely, and suicidal ideation, did they have more likely to have mortality than people that were that weren't sexual minority? So what we found in this diverse cohort is that people of sexual minority status had 5 times higher likelihood of suicidal ideation. And this is important, very important, but there's also an indication that females experience suicidal ideation, female minority, sexual minority, more suicidal ideation than gays, even after controlling for age and ethnicity. So what does future research indicate? Well, we can have more longitudinal studies to understand the precise connection between suicidal ideation and sexual minority. And so our conclusion is that minority stress theory can be something that purport that lesbian, gay, bisexual, and transgender individuals have suicide. So basically mental health, there needs to be a gap bridged between mental health and physical health, and that is very important. I hope this has made some sense. Thank you for